Good afternoon and welcome. We thank you so much for joining us for today's Hot and Bothered Living with Menopause webinar. I'm Dr. Christy Murray, president of the Alpha Kappa Alpha Sorority Incorporated Psi Psi Omega Chapter. We serve the counties of Stafford and Fauquier counties in Virginia. Our chapter proudly implements the 2022 through 2026 International Administration's theme, Soaring to Greater Heights of Service and Sisterhood, under the leadership of International President and CEO Danette Anthony Reed. Today's webinar aligns well with our Empower Our Families program initiative focused on our seniors. We're excited to advance the dialogue today to discuss important healthcare topics such as menopause, which affects most women at some point in their lives. Menopause is a natural process that marks the end of a woman's reproductive years. It's caused by a decline in estrogen levels and the ovaries stop to release eggs. This issue can present physical and emotional symptoms. Physical symptoms may show up such as hot flashes. Emotional symptoms may show up as sleep disruptions, low energy, or even mood swings. Both physical and emotional symptoms can affect how we feel and how we live. What's encouraging is that we don't have to simply suffer through these symptoms and with our menopause transitions. We can learn from each other to better understand menopause and how we can gain relief from those symptoms and with other treatments and remedies. That's why we're here today. So we look forward to hearing from our esteemed speaker, and we look forward to the robust discussion that we're likely to have today as we discuss living with menopause. Next, I will turn it over to Dr. Zerline Chambers, who will provide us with a prayer. Again, thank you for joining us and welcome.
Good afternoon, ladies. Father God, we come to you to say this beautiful, beautiful afternoon that you have made for us to come together and to learn from one another. We thank you, Lord, that concerns will be met and answered, that all the things that anyone needs to know will be able to be given to them or a mechanism to obtain it, that when they walk away from this gathering today, that we will be able to be empowered to advocate for ourselves more responsibly and boldly for the things that we need as women as we transition through the different parts of our lives. So I just thank you, Father God, for that strength, that boldness, that ability to advocate for one another, to be empowered to do so. And I just thank you for the women that have brought this together. And I thank you for the women that have come and attended. And we just give you the highest praise. Hallelujah. It's in your son, Jesus' name that we praise you, and amen.
Leslie, you're on mute.
I apologize. Thank you. Good afternoon, everyone. My name is Leslie Bruce, and I will be facilitating this event for you this afternoon. But before we get started, let's go over a few housekeeping rules. This webinar will be recorded for future use. Photos may be taken for recording purposes. Please mute your microphones to minimize background noise, and use the hand raise or chat function for questions and comments. And now for the disclaimer. Only general information will be shared in this webinar. Nothing shared in this webinar will substitute for individuals consulting a licensed medical professional about his or her specific health or wellness circumstances. Attendees should not disclose their medical or healthcare information during this event. Next slide, please. Our speaker this evening will be Dr. Zerline Chambers-Kersey. She's an obstetrician, gynecologist, and cosmetic expert in Dumfries, Virginia, and has over 43 years of experience in the medical field. She is a graduate of Rutgers, New Jersey Medical School and is affiliated with medical facilities such as Reston Hospital Center and Centara Northern Virginia Medical Center. Dr. Chambers runs a state-of-the-art women's health and aesthetic medical practice. In addition to providing complete menu of gynecological and obstetric services, including annual wellness exams, disease screenings, basic infertility evaluation and treatment, and prenatal care and delivery. The practice also offers an ever-growing list of cosmetic services, including laser skin resurfacing and hair removal treatments. Help me welcome Dr. Zerline Chambers-Kersey.
Thank you, Leslie. I'm so glad to be here before you ladies today. And once again, I said, I hope that your concerns and questions will be met to the best of our ability to do that today. And it will be really good that you learn the things that you can ask of your own provider so that you can have more detail and be empowered to advocate for yourself once again. So we're talking about menopause. And as Dr. Mary has said, what is menopause? It's a normal part that women go through in their lifespan. And it's when the ovaries stop making and producing eggs. And then we go through we have no cycle for 12 months. And then that's what it is. So how does menopause make you feel? I found some pictures that I thought were like maybe descriptive of what we may feel like. You get increased irritability. Sometimes you get anxiety, you can get depression. It's just an emotional roller coaster. That's one of the things that a lot of the women will complain about in the brain fog. They also can have sadness and anxiety once again. And as the Krabby Road says, when a menopausal woman says what, it's not because she didn't hear what you said. She's giving you a chance to change what you said so we don't come back at you. And that's a very common thing that happens. So in the 7 stages of menopause, as I found on a little thing, was the itchy, the other one itchy, the sweaty, the sleepy, the bloated, the forgetful, and the psycho. And I hate that they make us seem that way, but for us, tend to be level keeled that when we start losing control, we feel loss of control, it makes us really feel like we're really crazy acting. So, but you're only responding to what has been going on with your body. So I'd like to see the next slide. Thank you. Stages of menopause. Throughout our lives, women go through the different distinct reproductive stages, and each has its own significance and challenge. In premenopause, that's when you're not really menopause. That's puberty. When you become menopause, when you become a menstruating woman, and up to the mid-40s. And sometimes it can be a little earlier than that. It's always good to know your family history because some families have their cycles ending way later in life, like in late 50s, 60s, and others may start in their 30s. So it's good to know as much as you can of your family history for the women in your family when they actually went through or started getting symptoms. And the symptoms in the puberty to the mid-40s is just nothing. We're just living life, la vida loca. We're living our best life. And fertility at that time is at the highest as we have your most of your eggs. Perimenopause is in the mid-40s to the menopause time, and symptoms can be very intense and fertility declines rapidly. At age 51 and over, you will see moderate to intense issues and your fertility officially is ended. And post-menopause, women just have everything mild, gets lighter, becomes not as involved, and fertility is definitely ended. So next we have information that what if you're feeling irritability, cramps, you can't sleep, insomnia, vaginal dryness, mood swings. That can happen with a woman even before she gets to the menopause, the perimenopausal period. And that can happen after deliveries, having your babies, different things like that. Different things need to be evaluated to make sure that there's not a reason for you having the issues with your cramping or your cycle being off or heavier or lighter. And so then when you start going closer to your last period, we have the perimenopause. During that time, your cycles can be all over the place. And you start getting sporadic night sweats, not all the time, but sometimes, and they start increasing in intensity. You may notice a little weight gain, little hot flashes, loss of libido. And a lot of times that loss of libido is because you're tired because you're not sleeping as well. Then you get to the menopause when you've come a year without a cycle. And sometimes it's not necessary to make someone wait a whole year for not having a cycle before you start treating them. And there's mechanism of things to treat during that interim time so that you will not have to take and suffer and have to wait to get to the next stage. And in menopause, most women complain of still like the brain fog, achiness all over their joints, depression. We also can literally get bone loss when we do DEXA scans where they measure the bone density of your bone. And of course, the vaginal discomfort from the atrophying of the tissue in the vaginal vault. And then we move over to the postmenopause where that vaginal discomfort is really the worst. Osteoporosis where your bones are truly thinned, urinary tract infections because the vaginal mucosa is no longer well vascularized. And so you wind up having increased risk of getting urinary tract infections, and also heart disease can come. And it's not a result of not having something, it's just as we age, our vessels have had more time to pick up plaque. And the older you get, the longer you live, the more chance, unless you're living a life that doesn't allow your cholesterol to increase, those other things will happen more. We become more sedentary as we go through because we're tired. It's a vicious cycle. So those are some things when you get permanent cessation. It's not that the menopause actually caused it, it just helped usher it in by the symptoms that it causes in your life. And then they wind up happening. Okay, I'm ready for the next one. So we have a little quiz here. And then you can raise your hand and say what you think. So my whole body just has pains and aches all over. I'm totally fatigued and I have new or worsening allergies, which people may not relate to being anything menopause or perimenopause. Who thinks that is menopausal and who thinks that's perimenopausal? Okay. Ladies, how are we gonna, you need me to do that?
Dr.
Well,
Chambers, this is
okay, I see
Leslie.
someone has said, Cassandra said menopausal, and someone else said perimenopausal. Dr. Mary said, well, I have to say it can happen in both. It's just worse in the menopause, but you can start feeling these things in the perimenopause also. Brain difficulty, concentrating, dizziness, anxiety, panic attacks, depression, headaches, and memory lapse can happen. It'll start happening in the peri, but it can be in both of them. It's just because more exacerbated. Digestion, weight gain, gas and bloating, constipation, loose stools, nausea. I don't know what that all has to do, but I guess as things slow down, the way we eat, these things can happen and there's ways to get around them so they won't. Urinary tract infections and urinary leakage and urgency, incontinence, these things also can be addressed and they can happen in either, but more in the postmenopause. Heart disease with palpitations and high blood pressure, it builds in the peri, but it's most prominent in the menopause. What about hair and skin? What do we think about the hair and skin? The itchiness, brittle nails, thinning, loss of hair, and dry skin and wrinkles. You think peri or postmenopause? Peri, okay, okay. Both, both, okay. All right. It can happen in both. It'll start in the peri, and then the menopause just becomes more I can't even say exaggerated. There we go. I apologize. And so that most of these things can happen in both, but they get more exaggerated once you get to the menopause. But I agree, perimenopause is where you're going to see this one most. That's when it's going to start. You're going to start seeing it. Hard stuff more in post. Reproductive. How about increase in PMS? This is a good one. Period pain without a period. Well, that's a giveaway. Heavy bleeding during the period. We got them all mixed up here. Short or lighter periods. Let's take out the one that says period pain with or without a period. No, we'll leave it in. What do you think that's peri or post? Sharon Smith. Yes, that is Perry. Is definitely Perry. PMS, because you're having the menses. That's a giveaway right there. Period pain with or without period. And that perimenopause, you're going to be missing cycles here and there. And your body may feel like a cycle's coming, but it doesn't. But you go through all the pain, the breast bloating and all of that all happens, but it doesn't come. And then the next month or so, you get an actual cycle. Heavy bleeding during your period. Once again, in that perimenopause, things are like crazy. Short or lighter periods also in the perimenopause. No period is in the menopause. If you get a cycle or start bleeding after you've been menopausal for more than a year, that's a serious situation that needs to be evaluated. Weird but true, a bitter metallic taste in your mouth. Sometimes your taste gets off. Tingling and numbness or pins and needles, feeling chills. That happens more in the post-menopause, in the menopausal period. Okay, so now it's a love-hate relationship. In menopause, you say, oh, no more periods, yay. But bye-bye birth control pills and sayonara PMS, because you're not having a period anymore. Fibroids, what's fibroids? You know, the fibroids are not going to really grow anymore, but they still should be monitored once you get in menopause, because if they do continue to grow, that could be an alerting thing, because your estrogen levels are lower and there's no blood going through there filling them up, because fibroids are like vampires. They function off of blood. And if the blood's not going there and saturating them up and feeding them, then they shouldn't be growing. So if you have them, don't think I'm in menopause. They are supposed to shrink and go away or not get any larger, but you do need to follow it up in the very beginning of this time when menopause happens for you, at least within the first 2 or 3 years. I can't take naps like a baby and not feel guilty about it. Okay. Craving chocolate? Heck yes. All right. And then the I love you not. Oh God, I feel like I'm about to go up in flames. My vajayjay is so dry, I think I just heard it crack. Does that fat make me look fat? Shut up. Shrinking sucks. I used to be 5'11". So we lose our height from the osteoporosis. If you get that, everyone won't get that. Does that fat make me look fatter? You don't have to get fat. There's things we could do to stay that off. And your vajayjay is so dry, I think I just heard it crack. That is something that can happen, but we have things to help fix that. And oh God, I feel like I'm about to go up in flames. Once you get in post-menopause, that kind of like goes off. You tend to get more cold. Remember the one that had to like, I feel chilled. So does anyone have any questions for what menopause is, what perimenopause is, the things and symptoms that happen, realizing that one's going to start those symptoms up and the other one's going to have them escalated. And once you get all the way to the other side, they're going to take and kind of like start fading off. Not all of them, but a lot of them will. So any questions on that, you can raise your hand and ask questions now. Okay, so we don't have any questions. We got it. That's good. Okay. Am I misreading that, ladies? I don't see any questions.
Yes, Dr. Chambers, you do have one question.
One hand raised.
Oh, okay. I
believe it was Andrea.
Mhm.
Can someone tell it to
Hey
me? Because I
there.
don't see it.
Yes, thank you for doing this. I do have one question. I know every woman is different, but on average, how long does it take for a woman to go from one start of the process to get to the, looks
Other
like the
end?
light at the end of the tunnel, if you will?
I would say an average time is, it could be up to like 5 to 10 years. From the start of getting symptoms with the menstrual changes, the crampiness, the cycle changing, being irregular, to finally getting to a point where you stop having a cycle. And some women just go bam. I've had people that just stop having their period. That's the end of it. Never have a flash, never do anything. So you're not on you should be happy if you're one of those women, because some women just go right into menopause. They hit 50, 51, and they're just done with their cycle, never have any complaints or anything, bones, nothing else happens. So that's a generality of the time frame that it can take to go through, but at least a minimum like 5 years, to get from the beginning, and you start seeing things in your late 30s, early 40s to get into your 50 area time. I hope that answered. Did that answer for you?
That's very helpful. Thank you.
Okay, you're welcome. Any other questions?
Yes, Dr. Chambers, I don't see any other hands. This is Leslie. Are there any specific types of foods or beverages that increase the intensity of your hot flashes?
Actually, yes, there are. If you take in like sodas, uh, coffee, caffeine, there's some benefits to caffeine. I won't put caffeine down, but those are some wine, alcohol, wine, red wine is like the worst. Because I had one woman she was on everything we can know to man. And she was like going, I just can't sleep through the night. Fall asleep from my little wine, my 2 glasses of wine, and I wake up a couple hours later and I'm sweating and I'm hot. Red wine is like the most offensive thing. You want to think of something to relax you, but it actually will take and have you flashing like crazy. Actually, and alcohol in general, like whiskey and things like that, won't do it as badly as wine. Wine is a big offender. Caffeine can do for some people, but not all people. It just varies. So it's like menopause is not, hope what I'm trying to show is that menopause is not a recipe thing that we can just say you're going to go A, B, C, D. Everyone is different and everyone needs to be addressed as an individual with what your symptoms are and to rule out things that are not the source of those symptoms before we put it on just being perimenopause or menopause or postmenopausal. And that's unfortunately something that happens a lot. They'll say, oh, you're just, you'll be all right, you'll get through it, but sometimes there's some other pathology or something else going on. So I hope out of all this that these are some symptoms, but it doesn't mean that the symptom does not need to be investigated. I would always investigate, what can you do? What can you do to deal with vaginal, let's see, is that vaginal dryness? I saw like a piece of it.
Yes, vaginal dryness.
Vaginal dryness, that is definitely due to the loss of estrogen to the vaginal mucosa. There are different things that you can utilize. I happen to have brought some little props. Here's a little thing called Intrarosa. It's a vaginal suppository, and it's actually made out of like coconut oil, olive oil, and another oil that is progesterone, and it actually breaks down to become an estrogen and a little testosterone, and that's what it becomes and acts in the vagina as such. There's other suppositories that they also have. Some women can, if they're not really far along with it, they can use vaginal lubricants. And Astroglide is a very good vaginal lubricant. It's not water-based, but you don't want something that's really a greasy, thick base either. But Astroglide's a good one. Drinking plenty, you don't think about it, but drinking plenty of water. Water helps supply the tissues with their moisture. And if you take and utilize if you're not drinking water and drinking stuff like coffee or sodas or juices and not getting that water in, your tissues are not hydrated. So if they're not hydrated well, then you're going to take and maybe have more symptoms from the vaginal dryness. But lubricants are good. That's what you need to use, a lubricant or an estrogen if you're able to have it. And some of these can be used even if you had a hysterectomy, you can use them definitely. The concern with the uterus being present is that you may get an issue with the lining of your uterus building up and causing postmenopausal bleeding, but that's not going to be a situation if your uterus is gone. So with your uterus gone, you can use that. And we also have in our office something called Mona Lisa, which is a vaginal laser, and that definitely helps because it stimulates all the mucosa. It brings the estrogen like effect on the lining as it heals. You get all the blood vessels and the nerves and all that come back, and it fluffs up that vaginal mucosa, makes it tighter, firmer, and more resilient. Like it used to be, allows it to be more flexible and give way instead of being tight. And so that's something that we use, the Mona Lisa vaginal laser. Mona Lisa Touch is a vaginal laser. So I think we kind of did. Does anyone have any questions?
Dr. Zerline, you
Uh-huh.
have several questions. One
Okay.
from Cassandra Chambliss, and she's asking, is there something that a woman can take over the counter? Cassandra, could you expand on that question?
Sure.
she's
I just wanted to know to deal with like the hot flashes and the night sweats. Is there something like vitamin or some kind of supplement that you can take, or would you recommend seeing a doctor to help get something prescribed?
I would say if it's really bothering you that badly, there are some things that they sell over the counter. And of course, we have big old Amazon. You can go and shop forever and find things on there. Do I put my stamp behind them? No, because I don't know that they're always going to work and they're very pricey, some of them. If I have someone having a really hard time in the perimenopause, I actually give them, we can give them a low dose birth control pill, and I have one here. The one that I really like to use is Nextellus. And I like Nextellus because Nextellus is low dose. The estrogen in it is plant-based. So because it's plant-based, it doesn't interact with it doesn't have to go through your liver. All the medicines you take tend to go through your liver if you take something orally, as opposed to put it on your skin and absorbed into it. So if it's going through your skin, it will take in, I'm sorry, something just beeped on my arm. Okay, so the Nextellus will take and allow you to have a better, less effect on your liver, because a lot of women, when we get into this middle age area, we may have hypertension or cholesterol or some other medicines, anxiety meds that people are on, and so that will affect your liver. So you don't want to do things that are challenging that liver. So we can take and use these low dose birth control pills if you have no contraindication, no blood clots, no undiagnosed reason for some abnormal bleeding, no abnormality of your uterus that hasn't been evaluated, no history of a stroke, blood or anything like that. So if you don't have any of those things that have happened, you could be a good candidate to utilize that. It will not stop the menopause, but it will allow you to live through the menopause for that moment in time, get you some time on those years that you're going to go through before you start feeling it through the pill. It will definitely come through the pill when the pill's no longer helping you anymore. So there are different things. And over for the vaginal dryness, you have hyaluronic acid. There's different preparations online that you can take and get for that to take and put in the vagina, and that helps. Also keeping your vaginal pH in good repair. And I tell some of my ladies, because sometimes they'll suffer from a couple of vaginitises, and I tell them they can use boric acid vaginal suppositories. So there's a lot, and I really recommend that you go with your the holistic thing is the boric acid suppository is like holistic. Um, the hyaluronic acid on the border, is close to that. But there's some other herbal things in that you just have that do exist. But I would have to sit with you and look at all your medications, see any family history, and go through. Make sure anyone is going to treat you with anything has gotten all the questions answered, to don't just give you something because it's there. Because everything natural can also cause an issue, because some of these natural things become like an estrogen-like thing. And if you're taking too many things that are estrogen-like black cohosh and a couple of other things, then that could end up being like a lot of estrogen, and that could be counteractive and causing you to have more heavy bleeding because you're putting more estrogen in your body, too much in your body. So you need to really go over individually with your doctor to find out what meds you're on, what situations you have, and to make sure you bring your bag in. I have people bring their bag in with all their supplements, and we sit there and we go through it and make sure that things are interacting and helping the other thing to become stronger than the other, that they really know that it's happening, because all things natural can also still take and cause a problem.
okay. Dr. Zerline, a couple of other questions. When one has a hysterectomy, are the postmenopausal symptoms more pronounced? And then the other one is, when you are considered postmenopausal, can you ever expect your memory or concentration level to come back without intervention through medication?
I think, yes, there's some different games and little routines that you can do to stimulate your mind to take and keep it up. And as long as you know that you're having a deficit, that's half of the battle. It's when you don't know you're having a deficit, that's when you're really in a battle. Okay, so if you know you're having an issue and you're not remembering things like you need to remember it, or the things that you're doing aren't fixing it, then you need to maybe get some medical treatment. But there are a lot of different games and things that stimulate your brain and that can be done to kind of keep you up without having to take a drug for your mind. The other question with the hysterectomy and having more intense symptoms when your menopause comes on, I won't say that it really varies, because the issue is not a matter of the uterus. The only thing you're eliminating is the bleeding issue. It's a matter of those ovaries stopping, and everyone gets hit the same. Vagina, uterus, uterus is just there for a baby to be housed in and serves no other function. But those ovaries are the key thing. And when they click off, different people, it's not going to matter hysterectomy or not. You may go through the same issues as someone that doesn't have a hysterectomy when it comes to the menopause.
Okay. Timekeeper, how are we doing? Okay. I like holistic treatments. What can I get to help with the short memory issues?
Since I don't know all of anyone's history, I don't want to name something out. I would need to sit down and talk with you and then know your history to be able to say, yeah, that particular thing is okay. Because like I said, once again, even though it says it's holistic or as a natural thing, it still can have an impact once it breaks down. Just like this intrarosa breaks down and becomes testosterone and estrogen, and it starts out just being coconut oil with extra EVVO, and it breaks down and winds up being like estrogen and testosterone. So I need to know your history before I would throw that out there, because I wouldn't want you to go get something and then you wind up in an issue with
Okay.
that.
Is that the suppository that you mentioned? Because one asked the question, what was the name of that suppository
Oh,
again?
the intrarosa is the suppository. They
Okay.
also have
If
something
we could
called,
put that,
did
if
you
we
put it
could put
up?
that in the chat, it would help.
Okay, I'll put that in. Intrarosa, there's also Imexy, IMVEXXY. Okay, I don't want that. Okay, I'll put it in after. Okay.
Okay.
All right.
Okay.
I don't want this.
And then what are your thoughts on patients who have had hysterectomy taking medicines like estradiol to treat menopause symptoms? And that's the last question.
Okay. I think that that's fine to take the estradiol. But I think that it would be better. You could take something that I would say something going through your skin that's absorbable. To take it in goes in better, it passes your liver up. Once again, if you put something on your skin, it absorbs right in, and that's going past your liver. They have a Eva mist that you can just put the estrogen on as estradiol, but it goes right through your skin. We also have the patches, different patches that you can put on, are just estrogen patches. When you take something orally, how much is really getting to where it's supposed to be? Like we were giving women estrogen that was supposed to fix their vagina, but it wasn't. Like how much was getting out of their digestive tract and going to their vagina? That's why we came up with these other things that you could put, the vaginal suppositories and the Imvexy, things like that, because you need to treat the area. So the less that you ingest something and the more you take and put something that goes right into your system, I really think that that's better.
One other question. How long are the different stages of menopause again?
Like I said, it could be like no time. You could just go from no issue to no cycle anymore and no issues. Or you can start like in your late 30s, early 40s with having like variations in your cycle, your weight, your mind, your vaginal situation, your vaginal dryness, and just keep going like up to 5 years, could be 5 to 10 years. That's why, they say it could be up to 10 years usually, but hopefully most people don't go that long. When we treat you, then it's not that long of a time of suffering or having to go through that. It really helps you to be treated along the way. Don't make yourself suffer, and there are some natural things that we can give you if you don't want anything that's a medication, but you don't have to suffer. You just have to have that conversation to find out what's bothering you the most. And a lot of people want to turn out to have sleep disorder because they have sleep apnea. And a sleep apnea, you don't get good sleep. If you don't sleep well, then you're going to be tired. If you're tired, you're going to be more easily get anxious and irritated. And you're also going to be off your game. And, more chances of you're going to be dizzy and you're not going to be, all those little things all follow one to the other just because you didn't sleep well. Your libido, who wants to be with someone if you're exhausted and you're not rested, you know, and then you don't want to go through that discomfort. So it's like that one little thing of not sleeping well leads to so many other things. And when you're stressed out, you will start flashing. Someone said, oh, they've been done 15 years, no cycle. And then all of a sudden they start, I'm having hot flashes again. And like I have someone, you know, are you stressed out about something? Sometimes just knowing yourself and being able to de-stress yourself and not get so stressed, those hot flashes will pass away. But if you get stressed out or you start laughing, I laugh a lot, you know, I would get all start flashing. I laugh too hard, you know. So it's like you just have to know yourself, enlist people to help you so that you don't get people leaving you. I had to ask people like, if you see me getting ready to say something north or south, touch me or say something like, I got it, you know. So enlist the people around you to help you because I'll be hurting somebody's feelings. You know, you don't mean to hurt their feelings. It's like you're seeing stuff go out of your mouth and you go like, did I just say that? You know, because you didn't mean to say it, but now it's out. You've said it, you know, so get people around you to help you and let them know I'm going through this thing. My son and my husband, they took advantage of it though. Sometimes they would go like, I said, no, I was not getting ready to go anywhere. But anyway, have the people in your office, if you got a good friend or your boss or someone to help you out. How extreme can mood swings get? They can get pretty bad if you really do have an issue underlying. Sometimes things bring out things that are already there, but just not evident. And then when you hit on it and then you exacerbate it, you know, then it, you know, so you start swinging really badly, that means that you may have some other underlying issues that needed to be addressed. And I don't know what's wrong. We're not crazy. I think I have a psychologist that I go to, and I think they're good. They help you to talk things out. Half the time, talking it out helps you to fix your own self because you're not thinking, taking time to think to talk it out, you know, or coaches, you know, life coaches. They really help you to like do stuff. So it's okay. Enlist these people because there's a lot of psychological stuff going on around this country and everywhere in the world. So it's not a bad thing and not an embarrassing thing to say, I got somebody that I talk to. You know, I think it's a great thing.
So another question is, I've noticed that I've been freezing cold for the last several months. However, I never see it listed or talked about as a symptom of perimenopause. What are your thoughts on that?
First of all, I would take and have your doctor check you for like your thyroid to make sure there's not, because some different things come out and we can't make an assumption. So don't make an assumption, investigate it first. So, you know, they may want to take and make sure you don't have some other entities. And once they are ruled out, then address it as what it is, you know, and gonna get a blanket like me. I have to keep my hands because my fingers turn blue, you know, so you don't make an assumption. That's the worst thing we can do is assuming that because my neighbor or my girlfriend or my auntie or this one had it. Go to your doctor and ask questions and let them advocate for them to evaluate and make sure nothing else is wrong. Because a thyroid disease can cause you to have being cold. It can also cause your metabolism to drop down and make you gain weight. Or if it's too active, it can make you lose weight. You're all of a sudden losing weight. So you just need to have someone treat all of you and not a piece of you. And that's the key thing. You know, don't go in and then roll out with not an answer. Always feel like your answer's been answered. And if you don't feel like it was, go back at it or go to somebody else that will answer it better. You know, I don't want, you know, don't let yourself be just shooed to the side.
Okay. Let's see.
Probiotics.
Yes, you saw it too. Thank you.
Uh-huh. Well, I'm a kombucha queen. I love kombucha. It's the best thing ever. But make sure you're drinking the right one because some of them have a lot of sugar in them. So you got to watch, read your label. Read your label and make sure it's not, you know, more than 10% of sugar and things. Should have more than 8 to 12 grams of sugar in anything you drink. And it is a good thing that it can help you unless you have any kind of special digestive issues that it might interact with. That's what I'm saying. Once again, it's important to take and talk with your provider because they know your situation and I don't. And I don't want to give an answer that really you shouldn't be getting because I don't know your situation fully. And so I just saw another one up there,
Okay.
but it went away.
No, there was one that she did have her doctor check it and it was normal. And she's now
Okay.
at a loss about being cold, freezing cold. It was that one. And yeah, that was the last one.
That
He
was the
said,
last
thank you for
one.
your thoughts.
Okay, okay. Well, ask your doctor, give you some suggestions of things that you can do. And sometimes it's just a matter of dressing differently. I mean, in my office, I got on gloves and I've been at conferences where I'm sitting at the front with the blanket from in the room and got gloves on and shoot booties and everything. And because it's so cold, I get so cold, so just make sure you make yourself warm, just dress accordingly because everyone's not everyone. And if you have an issue, take care of it. So other things like watch your dentition. We really our teeth can get really messed up during this time. So you got to have good dental hygiene and go see your dentist because we don't all want to be root canal and implanted to death. So you want to take and make sure that you go and have a good dentist and get good dental care. Those little electric shocks and sensations and tinglings in extremities, that's like little nerve impingement things that can be happening. And have that evaluated too to make sure that it's a nothing thing versus because sometimes people have carpal tunnel and they're saying I got tingling in my fingertips on my first finger here or here. And it's like, it's carpal, get evaluated. A lot of times it's carpal tunnel and it's not just something that can't be treated. So, in your hair, make sure you're getting like enough vitamins in and biotin and, to make sure that you keep your hair and don't put so many things on it and in it. A lot of things we put on put stress on our hair at the shaft. And so you have to be very careful with that because it's going to make your hair break off. So make sure you're doing good hair care. And if you just want to look good and you don't care what your hair looks like underneath, then just go ahead and just do what you have to do. Because sometimes we have to just look the way we need to look. And we can't just do anything about the hair going down the drain. So
How often should you have a vaginal exam, pap smear, once you're in menopause?
once you're in menopause, you don't have to have a pap smear more than every 3 years. I think Medicare lets women come every 2 years. Um, and you don't have to have an actual pap smear done. Some of my patients that I've been seeing for a long time, if you are in a constant monogamous or there's no one at all situation, then I look inside and make sure I don't see anything. And then I'll say, I don't see anything. And so they may opt out for a couple, 2 or 3 years. And the longest I'll go is 5 if they've had a history of an abnormal pap. See, all these things, caveats are important. If you've ever had a history of an abnormal pap, then you need to decide it with the doctor that's following you. Because I don't know how abnormal it was. I don't know if you had a biopsy. I don't know if you had a hysterectomy because your pap smear was abnormal and your cervix had some precancerous or cancerous thing on it. So all those things become important. So when they put out a blanket statement like, you don't need to have this, but this often, do you fit all the criteria for that? And I think when you're going through menopause and the perimenopause, you need to just come to the doctor just to see them yearly, for them just to check your breasts and have a conversation to kind of say what's going on and what can help you and what can fix things and make life more tolerable for you. So I think it's not just the pap. You don't see the gynecologist just for a pap. Hopefully y'all are having a conversation about what your life is like and what's going on, and if there's something else that needs to be addressed. Anything else?
So there are no
Okay,
more
we can pass
questions in
that
the
one.
chat, Doctor.
Going. We can keep going. So coping with depression, there's all these things. Number one, like I said, keep us in the loop. Let us know, because I got plenty of providers I can send people to. Plus, I support you. I will call myself. I will help you as best I can. Exercise, it really lets all those endorphins go out. It really makes a difference. Just you don't have to get on and kill yourself. Just go for a walk in the neighborhood. It's so nice right now, especially for those that may be flashing. Just go for a nice walk. And then but add a little exercise, because you give yourself about a good 30 minutes or 15 minutes worth of exercise. It just really lets you come down and you feel so much better. Socialize with your friends and family. Like, don't become a hermit. Meditate. When things start getting too much, know how to sit back and pray and just be silent. eat as healthily as you can. You know, life cannot become a frying pan, and it doesn't have to become a broiler either, and it doesn't have to become a salad all the way. But just read your labels. You want less than 10% of sodium, saturated fat, and carbohydrate. But realize carbohydrate is also made up of fiber. So if it says 30% carbohydrate and 25% of that is fiber, that's okay to have that. But you don't want more than 8 to 12 grams of sugar, because the risk of diabetes, we don't want that. That affects our blood vessels also, increases cholesterol situation. All these things lead to like things that could wind up with heart disease, high blood pressure. Reduce your alcohol intake. If that's something that you do, you know, just reduce it. Like, don't do it like every night, or if you're doing 2 a night, do maybe 1 a night. Watch out for the red wine once again, and avoid smoking. I know a lot of people are doing some other things other than smoking, just regular cigarettes. So just be mindful of that, of what you're doing, and just kind of give yourself a break. You know, take a break every now and again. You know, don't push yourself so hard. We live in such a society that we're always like just going, and we never stop to breathe. Take a moment to just step back and to breathe, and just, I go all the time. If I'm in the office and people coming at me left and right, I go, excuse me. And I run back to my office and I go, woo-saw. And I just sit there and I take deep breaths in and blow them out. And then I really feel re-energized, and I come back out and I'm genuinely ready to go back at it again, versus being a fake person. I'm not fake. I'll tell you the truth if I have to, but I go and re-energize myself by just taking some deep breathing and just relax, or I'll sit in my chair and just put my head down, let my neck go loose. Just do something to release yourself and to just relax for a moment, and then go back. If the office is getting you, the people are getting you, get your place where you go to and just chill out. And I saw someone had something, and you go to the next slide, and then I think I want to answer, somebody else had something. So there's ways to beat some of the symptoms. Get a restful night's sleep. If your room is all got the curtains all open and the sun comes in as soon as it rises up, you need to darken your room, and or get a nice face mask that has like a little heavy little cushion underneath that goes on the eye area, the lower eye, and put that on at night so that the light's not coming in. You know, turn off the TV. Try not to be looking at the TV or your laptop or your telephone, you know, at least about an hour or two before you're going to bed. Use blue light glasses to get that blue light down, you know. So make your room nice and quiet, and get your like a mask put on. And you could put the little cool packs on also on your eyes. And this actually has a cool pack in it. And just turn the thermostat down even. You know, I used to take and throw one foot out, and when I got cold, I brought it back in. And that kind of helped me not to have to get up and down. Try not to drink a lot of water just before going to bed, because if you are someone, maybe hypertension, or someone that gets swelling in your ankles or thing at the end of the day, use some compression hose. But if you do have it, you're going to get up and have to go to the bathroom. So maybe before you go to bed, an hour or two before, lay over on the sofa on your left side and get some of that fluid off your body so you won't have to get up at night. Changes in estrogen levels in your body, you know, you do get more inflammatory response. And so they have on here seafood, high in omega-3s. You can even take omega-3s. Lower your estrogen levels in your liver, cause buildup of scarring and damage, and due to alcohol. Well, I hope no one's drinking to that effect, but you know, if so, consult your doctor. And estrogen can help your body produce collagen, but also when I do the Mona Lisa does help the collagen and fibrinogen all come back into the vagina and make that more robust. And moisturize daily. Don't let your skin get dry so you won't be itchy. Regulate your cholesterol by eating the right things. You don't want an LDL that's very high, because that is one of the bad ones. And get your HDL up. HDL is the good cholesterol, that it needs to be above like 45, 50. And, you know, just pay attention, go and get those things done. You're not helping yourself if you don't get those labs done at least once a year. Your calcium and your vitamin D, make sure those are normal. If your bone density is off, those are the things I tell women they need to go get their primary care to run. And then if your bone density is really bad, then you need to get treated. You know, you need to be treated. So, but exercise, weight bearing, calcium, vitamin D, all those things can take and help also. And did I answer the other lady? The other question on the hysterectomy?
You did.
We did. Okay. Okay. What's the next slide? I think this is. And there you go, girls. You went from that woolly lady in the beginning to these nice smiling ladies here at the end. So your life is not over with menopause. It's really kind of just beginning on the other side. And we just have to get through it, but you don't have to expire in the process. If you get to your doctor and then go between your friends to kind of hear like what options that they've used that help them. Find out the things that didn't hurt them so much, would help them. Then come to your doctor or call your doctor up and say, what about me trying this? Like one of my patients wanted hyaluronic acid, but she had issues in her life and her medical history that it was going to be contradictory for her to be using it. Well, someone else could have it, so it's a good thing depending on who you are and what your situation is. So remember, you are an individual and should always be treated as such. And you need to write down your questions, come ready, and just ask the questions and ask for answers and expect to get an answer and some resolution, or at least have someone that's honest enough to say, I don't know. When I don't know, I'm going to go find somebody else that does know, and I will ask and I'll get it figured out. So, we don't know everything. None of this is perfect, but I have someone that's going to advocate to help you as you're advocating for yourself. And it doesn't have to be a bad, terrible thing. Don't revel in the negative stuff of it. Try to look to the high side of things. My father used to call me a Pollyanna, so you always see a silver lining in the midst of everything that's a mess. See your silver lining. Don't always want to own something that's negative. I have a big sign. You walk in my office, it says, pray more, worry less. When they come there, start whining, I said, come on, let me get the cheese. Go on out here, let's read the sign again. So have a purpose with your whining. Don't let it just be just random whining. Have a purpose for it. And it's not whining. You're just sharing how you feel. So don't people walk around think that you're whining, and don't own everything that everyone else has. I'm sorry that the neighbor got breast cancer. I'm sorry the neighbor got liver or something, but it doesn't mean that you have to have it. Don't own everyone else's issues. Be positive, but also be religious and taking care of what you need to have taken care of, and see the doctor. Thank you. Any other questions?
Dr. Chambers, this is
Uh-huh.
Emma Wilson. I have a quick question in regards to differences between minority women, specifically African Americans, and our counterparts, Caucasian women. Are there any things that happen during a menopause or perimenopause that are pinpointed for us that we should be on the lookout for or know that's going to happen?
I find that my women of color tend to be soldiers. They don't think of themselves first. They always put themselves last, versus the women that aren't of color. They put themselves first. And I don't know why we tend to do that. We tend to like push things out the way and make ourselves last in the scenarios of getting things done. Now, the younger women of color, now they come at it. They don't went to Google, doctor, everybody else, and they'll come. But my older women, just like we just accept things, tend to accept things and just say, I'm going to get through it and it'll be all right. And they don't come and ask a question or get assistance. And they get through it, but they didn't have to go through it the way they had to. So that's the main difference that I see. I don't see any more breast cancer in, between the two. I don't see any more. Well, and because of that, I have to say, I do see maybe a little bit more endometrial cancer in women of color, because we don't go and follow up on things that aren't right. Like I had some spotting, but I haven't had a period for 12 years. And you just kind of nix it off. And then, but they always tend to be early enough that they haven't been metastatic or gone throughout the uterus. But we tend to maybe get those things more, or a breast lesion abnormality more, because we just kind of like say, it'll go away, it'll be all right. And then they come in and I go like, what is this? Oh, that's been there. Okay, well, been there, it's got to go. So we just tend to dismiss our personal health a little bit more, but the younger women are a little bit more proactive. I have to say that. I hope that answered your question. But
It did. Thank you. I was just wondering in case you knew from your years of experience, we get flashes more, those kind of things. But you
oh
answered.
no, they get them too.
Okay. Thank you.
Yes, ma'am. Anything else?
Dr. Zerline, there are no more questions in the chat.
Well, I hope we're all smiling right now, knowing that you will come to this end too. And hopefully you're smiling at the end of it. And, I just want you to be able to think about the things that are bothering you. Don't dismiss them. You can look up and investigate, but go and share. You don't have to always come to the office for everything. We do the consultations over the phone and over the internet. Now that we have that, we become like virtual, but it's something about seeing people in person. So I just really appreciate you all coming out, and I hope that you have learned some things that will empower you to become bigger advocates for yourself and for your daughters and nieces and nephews and grandparents. And thank you so much.
Dr. Chambers, this is Leslie, and to all of our guests, thank you so much. Your presentation was insightful and very informative. So our next section will be giveaways. What would a seminar be? I'm sorry, what would a seminar at all be without giveaways? So we have 2 prizes to give away. And the first prize will be for the person who logged in first. And if I mispronounce your name, please forgive me. That is Janice Harris. Miss Berlinda Knight will direct message you directly so that we can get your prize to you. And then the second prize would be the first person to ask a question. And I don't have your direct name. I only have Divas for Divas there. So you are the second person to win. So I'm not certain if you want to put that information in there or we can direct message you. So congratulations to you both. You will both be getting 2 gift cards for that. Thank you. We are almost at the end of the presentation. Does anybody have any questions at all about anything that you want to ask? Anything that you like repeated, anything like that? It looks like there's a hand raised. Sharon Smith.
Yes, I just want to say I have thoroughly enjoyed myself this afternoon. I have completed my menopause phase, didn't even know I went through it. And, well, the only thing that helped me was when I started with the hot flashes. I discovered taking 2 or 3 sips of room temperature water made it go away. I am proud to say 74 years young, and I am enjoying life thoroughly. I have a lot to say, but I'm going to try to condense it. I want to say I bring you greetings from Paterson, New Jersey, Psi Psi Omega Chapter of Alpha Kappa Alpha Sorority Incorporated. And I'd also like to thank my sister, my real sister, my baby sister, Dr. Zerline Chambers. I am so, so, so proud of you. I didn't know you had it in you. So God bless you. Continue to do what you're doing. And to my sorors in the state of Virginia, I send you love, a lot of love. And this is the best ever for a Sunday afternoon. I didn't have to cook dinner for my daughter or my son, and they don't live here with me. I chose to tell them I had something to do. So God bless all of my sorors, and God bless you too, baby sis. Thank you so much.
So Dr. Zerline, from the comments, I pray that I go through the process like you, Mrs. Smith. This was very helpful. Thank you for the great information. Janice left her number. Lots of thank yous. Very insightful presentation. Thank you, Dr. Chambers-Kersey. Lots of hearts and love. Very informative. Thank you so much for the great information. Thank you so much. And let's see if I got them all.
If they need to
I'm
reach
giving
out,
you your flowers right now.
thank you.
Okay.
And if they need to reach out, we have the QR codes.
Okay. And then also, thank you for the great information. Greetings from Delta Omega Soror Angela Green, Vasquez, and then Sorcelia Vanoy Buford. Lots of little celebrations. And thank you, greetings from Xi Upsilon Omega. Dr. Chambers delivered my babies years ago. Hot dog. And that's it. And I did see on the screen several other D9, especially Delta Sigma Theta Sorors as well. Sorority as well. And that's it from the chat section.
I know that we are going to get the QR code for Dr. Chambers' business up on the screen, but I'm not certain if we got information from Divas for Divas. That was the second winner.
Yeah, I haven't seen anything yet on her. I don't think that person is still on. I didn't see her any longer.
Okay.
Yes, she is. Her name is Aretha Bettis for Divas for Diva.
Okay, thank you.
Will we know how to get in contact with her?
Regina Webb would definitely have her contact information, or I can give it to you.
Okay. What is her name exactly?
Aretha Bettis, Aretha.
Okay. All right.
Last name Bettis, Bettis.
Okay, thank you so much. Okay, in closing, if there aren't any other questions, I still see a bunch of thank yous coming through. This has been extremely informative to me. I loved it. One of the things that I did not know is that you could wait 3 years before you have a pap smear when you were in full-blown menopause. So that was something that I definitely learned today, and I trust that everyone else learned something too. But again, Dr. Chambers, we thank you so much for imparting all of your knowledge to us in this talk, and to our guests. We thank you so much for attending today, and I hope you enjoyed your time at our event and also found it helpful. For survey purposes, you will receive a short survey that will be emailed out to you via email. Very short. It will only have 8 questions, and we would appreciate it very much if you could just fill that survey out. It'll come directly back to us in the email, just to let us know what your experience was with us today. And again, we thank you so much for attending, and have an awesome evening.
Okay. So the last thank yous were greetings from Xi Upsilon. Dr. Chambers delivered the babies. There was one
Vaginal sub.
from Deborah Wells as well, who said, oh, there are 2 new messages. Hold on. Oh, okay. So the spelling of the name of the lubricant is on. Intrarosa and Imvexy. Vaginal.
Suppositories, yes, ma'am.
Vaginal suppositories. And my daughter-in-law, Lisa Jenkins DePisa, said, excellent session.
Thank you, everyone.
And I do see Aretha's contact information, so thank you.
All right.
Can we get the QR code?